Hi everyone, I'm Lily, and today we're going to talk about the effects of the carnivore diet on cardiovascular health. So first, we're going to introduce the carnivore diet, then we'll discuss ketosis, then explain the cardiovascular connection, and then talk about research findings, and then what my conclusions were. So what is the carnivore diet? The carnivore diet is a common weight loss diet made popular through social media. This diet follows a strict meal plan that participants can only consume red meat, poultry, eggs, seafood, water, and a very select few amount of dairy products. Hence, no vegetables, fruits, nuts, or grains will be consumed. The purpose of this is to put the body into a state of ketosis. So, how does the body reach ketosis? When the body has a lack of carbohydrates, this means that there will then be a lack of glucose. When the body cannot gain enough calories from glucose, it will have to turn to fat stores in our body. Fat stores, also known as our triglycerides, and some amino acids are broken down by lipase to produce ketones, which are then used as the body's energy source. What does ketosis do? So once the ketones are produced, they are released into the bloodstream. In the bloodstream, ketones will increase the acidity of the blood, and then that means the body will have officially reached a state of ketosis. So the cardiovascular system consists of the heart, blood vessels, and the blood within them. A common disease that affects the cardiovascular system is coronary heart disease, also known as atherosclerosis. So this occurs when fatty substances build up in the coronary arteries. When this fat builds up, this will slow the blood supply to our heart. As you can see on the right, the pictures of the plaque build up. So you're at a higher risk of developing coronary heart disease if you have high LDL cholesterol, which is our low density lipoprotein cholesterol, also hypertension and diabetes. So what are the carnivore diet's effects on the coronary heart disease? According to a study conducted by Oxford University, 50 grams a day or higher of processed meat consuming 50 grams or higher a day of processed meat increases a person's risk of coronary heart disease by 18%. Consuming 50 grams a day or higher of unprocessed red meat will increase the risk of coronary heart disease by 9%. Their results help to prove that when there's an increased consumption of saturated fats while participating in the carnivore diet, LDL cholesterol along with this will increase. And when this cholesterol increases, there's a significantly higher chance of developing coronary heart disease. So now let's discuss some of the research findings. In a human observational study, the method used was to survey 2,029 people participating in the carnivore diet for at least 6 months. The goal of this study was to determine the long-term tolerability of the carnivore diet along with its health effects. In the findings, they found that of the people participating, 85% reported they consumed red meat daily or more often. With this, the LDL cholesterol levels they saw were marked as elevated at 172 mg/dl, which is a normal level would be at 100, while HDL cholesterol and triglycerides remain normal. So this connects back to a research question because when you're participating in the carnivore diet, an overconsumption of red meat will elevate LDL cholesterol, which directly increases the risk of developing coronary heart disease. In another study that was a human randomized control study, 113 volunteers were placed in either a high or low saturated fat randomized grouping. The participants underwent three 4-week caloric diets, and then they underwent weekly urine and plasma tests. So, the goal of the study was to determine the impact of TMAO levels on chronic dietary patterns, specifically what red meat versus white meat's effects would be. In the findings, they found after 1 month of a red meat inclusive diet, majority of the participants saw a threefold increase on plasma TMAO levels, along with significant increases in urine TMAO. In the image below, we can see that during the red meat diet, the level of TMAO experienced a significant increase. So how does this connect to our research? High levels of TMAO, which is a metabolite produced by gut bacteria, have a direct correlation to increased cardiovascular disease. This is because TMAOs to contribute by making platelets hyperreactive. And when this happens, this induces a inflammatory response, which results in an increased plaque buildup within our arteries. Lastly, for our third study, we had a controlled intervention study which used mice. So the key method of this was to use genetically modified mice and put them on a Western diet, which would be high fat and high cholesterol for 16 weeks. Then their aortas were harvested and they analyzed the atherosclerotic lesions. The goal of this study was to investigate the role of FXR, which is farnesoid X receptor, on the development of atherosclerosis. In their findings, they found that having an FXR deficiency could accelerate atherosclerosis. FXR activation was also found to lower um, plasma triglyceride and cholesterol levels. And in male mice with FXR and LDL receptors, there was less plaque found in the aortas due to lower LDL cholesterol levels. So this connects back to our research because this article explains how an FXR deficiency in mice can subsequently lead to higher LDL levels. If we look at the image down on the right, you can see that in the LDLR column, you can see that these are the increase. So these are the columns that show the lack of the FXR receptor. So in both the male and female columns, there is a significant increase in atherosclerotic lesions. So the importance of this article is just to open our eyes to the fact that genetics are also a major contribution to how the carnivore diet can impact a person's risk of developing cardiovascular disease. So overall, my conclusions are that while the carnivore diet may help a person to lose weight quickly and effectively, the long-term effects of this can be majorly detrimental to our cardiovascular health. Due to the increase in cholesterol of someone participating in the carnivore diet, the risk of coronary heart disease will become even greater. So, if you are considering the carnivore diet, I believe it's the best way to do it, if you are going to do it, would be to stay away from processed meats along with red meats and to focus on poultry and fish-based foods with less saturated fats in them. Along with this, make sure to pay attention to your genetics. If you have already are at a high risk of cardiovascular disease, potentially consider a different diet. Thank you.